So, have you ever wondered what kind of screening tests are really recommended for you? You hear people talk about pap smears and mammograms and x rays. Well, let's dive into that just a little bit deeper. So, this information comes literally straight from the horse's mouth from the United States Preventive Services Task Force, a group of experts in the nation that have come together and have done the numbers to determine what age, what gender, what risk factors require what kind of screening. There are several categories, but the two that we're going to highlight are category A, which means it has a high certainty that the net benefit is substantial, and category B, high certainty that the net benefit is moderate. Both are important, both are helpful, one more so than the other. The first we'll talk about is an abdominal aortic aneurysm screening. So, this is for men ages 65 to 75 who have ever smoked. An abdominal aortic aneurysm is a ballooning and subsequent rupture of the main artery in the abdomen, more likely to have an issue in men and men who have smoked. The screening generally involves doing an abdominal ultrasound. The next is related to breast cancer in women. Maybe you've heard of the BRCA gene. So, women with a personal or family history of breast, ovarian, tubal, or peritoneal cancers, or women who have taken a risk assessment and scored positive, should receive genetic counseling. To learn more about screening, talk to your primary care provider. Next is the actual use of medication for prevention of breast cancer in women who are at increased risk for breast cancer aged 35 years or older. Then, essentially, every woman from the age of 50 to 74 should have a mammogram every other year. The USPSTF also recommends screening for cervical cancer every 3 years with a pap smear in women aged 21 to 29. And then for women aged 30 to 65, they recommend screening every 3 years with a pap smear or every 5 years with a high risk HPV pap smear or every 5 years with the combination of the HPV testing and pap smear. Sounds a little complicated. Again, talk to your primary care provider whether or not this applies to you. For years, the recommendation to have a colonoscopy or screening for colorectal cancer began at age 50. Now it has been moved up to the age of 45 due to the increased incidence of colon cancer in younger adults. So it is a category B recommendation to have colorectal screening like a colonoscopy during the ages of 45 to 49. Then at age 50, it becomes a category A recommendation between the ages of 50 and 75 to have colorectal screening. It's recommended that healthcare providers offer adults with cardiovascular disease risk factors to behavioral counseling interventions to promote a healthy diet and physical activity. It's recommended that adults between the ages of 18 and 79 be screened for hepatitis C. It's also recommended that adults aged 15 to 65 be screened for HIV. Adults over the age of 18 should be screened for hypertension, also known as high blood pressure, with an in-office blood pressure measurement. And it's recommended that adults between the ages of 50 and 80 who have smoked what's called a 20-pack year smoking history, meaning that would be equivalent to smoking 1 pack a day for 20 years, or 2 packs a day for 10 years, or who have quit within the past 15 years, should be screened for lung cancer. Women who have gone through menopause and are younger than age 65 are at increased risk of osteoporosis and should be screened for that. And all women over the age of 65 should be screened for osteoporosis. This generally involves an X-ray called a DEXA scan. Any person between the ages of 35 and 70 who is either overweight or obese should be screened for prediabetes and type 2 diabetes. The USPSTF also recommends screening for depression in adults. Adults between the ages of 40 and 75 who have one or more cardiovascular risk factors should be prophylactically placed on a statin to lower cholesterol and to protect them from heart disease. You should talk to your primary care provider to see if this applies to you. And finally, the USPSTF recommends that clinicians, healthcare providers, offer or refer adults with a BMI of 30 or higher to intensive multi-component behavioral interventions. So if this applies to you, the We Are Fully Alive health coaching services are one step addressing this major risk factor. So an ounce of prevention is worth a pound of cure. I strongly encourage you to talk to your primary care provider, have your individualized risk factors evaluated, and come up with a personalized plan for prevention